Thanks for that introduction, and thank you all for joining. That was a great introduction, but the only other thing I would add is I thank my wonderful mentor, Julia Rafeman, for her assistance on this project. This slide acknowledges my training funding support from the National Institute on Drug Abuse and the National Institute of Mental Health. Before the COVID-19 pandemic uprooted our lives, lesbian, gay, bisexual, and transgender adults were already disproportionately likely to be in poverty. Research from the Williams Institute at UCLA summarizes the literature on what we know about LGBT poverty, showing that 1 in 5 LGBT people are in poverty, compared to 1 in 7 cisgendered straight people. Trans people are especially likely to be in poverty, nearly 1 in 3. The reason for such baseline disparities is structural stigma and social marginalization. LGBT individuals are substantially more likely to experience homelessness as youth and to face discrimination in employment and medical care. It should be further noted that many in the community face intersecting forms of marginalization based on the color of their skin, their gender, or their disability status. To the left, I show one theoretical model for structural stigma as a fundamental cause of health disparities by Hatzenbuehler, Phelan, and Link. This model explains how structural stigma manifests in the form of stress and lower SES for marginalized groups, and the model describes how such stigma evolves into new mechanisms to maintain the power structure over time. The COVID-19 pandemic has exacerbated US societal divisions and disparities. This is especially evident regarding the negative impact on low-income Black and Latino groups, but less is known about the social impacts for the LGBT community. So that brings us to our research question. Are structural inequities for LGBT individuals exacerbated by the US COVID-19 epidemic? To answer this question, we turn to the Understanding America study, a nationally representative internet panel of 8,500 respondents housed at the University of Southern California Center for Economic and Social Research. We specifically used data from the Understanding Coronavirus in America survey, which follows respondents over time from March 2020 to present. We only examined primary respondents with non-missing data for our variables of interest. Following respondents over time, we assessed whether LGBT individuals were more likely to report losing their job than their cisgender heterosexual peers. In the latest wave of the survey, we also assessed if there was any association between sexual orientation and gender identity and reporting indicators of financial precarity. For all analyses, we followed Understanding America study guidelines for accounting for survey weights, and all analyses were conducted using Stata 16. For longitudinal analyses, we used a Cox proportional hazards model with reporting job loss as the quote failure event. We examined this for different groups of LGBT individuals and adjusted for age and race and ethnicity. The indicators we looked at to assess financial precarity were financial insecurity, defined as confidence in the ability to pay for an unexpected expense in the next month, housing insecurity, defined as missing a rent or mortgage payment in the last month, and food insecurity, defined as going without food for a whole day in the past week due to lack of money or other resources. In a cross-sectional analysis of the latest wave of survey data, we assessed the association between sexual orientation and gender identity and the indicators of financial precarity outlined in the previous slide. We again adjusted for age and race and ethnicity. The next 4 slides outline baseline demographic characteristics from the March wave. In the interest of time, I will move quickly through these slides, but 2 main points. The LGBT group in the sample is generally younger than the cisgender heterosexual group, and quickly through here. A noticeably larger proportion of LGBT people, especially trans folks, are in the lowest income bracket. The next 3 slides show the post-COVID-19 job loss by sexual orientation and gender identity or expression. In unadjusted analysis, at any point in the first 6 months of the US COVID-19 epidemic, homosexual, bisexual, and unsure individuals experienced 2.3 times as much job loss as heterosexuals, a significant difference. On the left shows the survival curves for these analyses. These track the proportion of each group, heterosexual or LGB, that still have a job. Notice a sharp drop between wave 1 and 2 and a sustained and widening decrease in the proportion of individuals not reporting job loss. The blue curve shows LGBT people, and the red curve shows heterosexuals. The next slide shows the same comparison, but broken out by sexual orientation. Notice bisexual individuals are significantly more at risk for job loss in this time period. Finally, transgender folks face the biggest disparity in job loss, with a significant 4.2 times as much job loss at any point in the first 6 months of the US COVID-19 response. After controlling for age and race, the magnitude of all hazard ratio estimates for these three models got slightly closer to the null, and these observed differences were no longer significant. We hope to explore possible explanations for this finding. I think part of the reason adjusted models outcomes are no longer significant is due to the larger proportion of LGBT people in the sample being young people who are at the start of their careers or maybe working in jobs in the service industry. However, we have yet to look into type of employment, though we intend to. The next 4 slides shows the financial precarity outcomes from the latest wave of the survey, which was August to September for our analysis. In the interest of comprehensiveness, I provide the tables for the unadjusted and adjusted logistic regression models, but pay most attention to the interpretations at the right. First, financial insecurity. After adjusting for race and ethnicity, cisgender and non-heterosexual, i.e. homosexual, bisexual, or unsure individuals were significantly more likely to report being unable to pay for a $2,000 expense than cisgender heterosexuals. Specifically, 2.09 times the odds, or 15 percentage points higher predicted probability, on average, of reporting financial insecurity. Also notice the large significant differences for this outcome by race ethnicity.
Tim, you're almost out of time, then you go into your questions time.
Thank you. I should just have about 1 more minute. There were no significant differences by sexual orientation or gender identity or expression for missing a mortgage payment or for rent payment in the past month. Finally, looking at food insecurity, LGBT individuals were significantly more likely to report going without food in the past week. There's a large odds ratio, but a small difference in predicted probability, indicating that this is likely a less common event overall, but LGBT folks are still more likely to report experiencing it. So our conclusions. This study found that LGBT individuals are significantly more likely to report indicators of financial precarity than cisgender heterosexual individuals in the wake of the COVID-19 pandemic. In unadjusted longitudinal analyses, LGBT individuals were significantly more likely to report job loss in the 6-month study period. Analyses adjusted for age and race were not significant, but were of similar magnitude. In unadjusted and adjusted cross-sectional analyses, LGBT individuals were significantly more likely to be unable to pay for an emergency expense in the next month and to report going without food for a day in the past week because of lack of money or other resources. Thank you.